So quickly, mandibular canine extraction landmarks. Here's a tooth that's not only malformed, but it's also fractured. We're going to extract this. One thing that I will mention here, the younger the patient, the larger the pulp cavity. So as the patient ages, the dentin continues to be produced at the pulp-dentin interface, and so the pulp cavity will be smaller as the patient gets older. In this patient, you can see that the enamel has actually exposed into the pulp because the pulp's so large in this young patient that as you get apical, the tooth dentin gets really thin, and these can be difficult extractions, so keep that in mind. So here is the exposure of the bone on the extraction. What we do is we don't do a vertical releasing incision. We come up here, we go right in the gingiva, follow this around in the sulcus adjacent to these premolars, and although this looks like we did a vertical releasing incision, you'll see when we close it's not. We're just retracting that with a elevator to expose the area. The metal foramen is here, right underneath the mesial root on that second premolar. You're going to expose that to that metal foramen, and you're going to remove bone from coronal to apical as you go this way in order to expose that foramen, and that's where you're going to stop. And then you're going to create your moats just like we did before, and then luxate accordingly. So there's the exposure. Here's the foramen. We've actually done a little ledge here as well, like we did on that mandibular first molar, where we took that crosscut and went up underneath here a little ways. This tooth dives lingually, so we can kind of follow it by feel and partially visually as it dives lingually, and remove some of that bone off of that tooth to make this extraction easier. There you have the finished extraction. Always want to take a radiograph after every single extraction. Here's the passage of the needle through the lingual aspect, the vestibular aspect of that mucosa to close the defect. And then there, as we mentioned before, there's no vertical release here. That's just an envelope flap all the way there. We always do in our practice vertical releasing incision mesial with maxillary canine tooth, but on the mandibular canine tooth we do not. We don't feel that we need to. We just